Good afternoon. I'm Monica Hendrickson, the Public Health Administrator for the Peoria City County Health Department, and welcome to our weekly Tri-County update for COVID-19. As of Thursday, September 9th, the Tri-County now sits at 50,024 cases to date. That is an increase of 664 over the past week. Peoria is now at 25,381. Tazewell County is at 19,164. And Woodford County is now at 5,479. To date, deaths attributed to COVID-19 for the Tri-County increased by 15 over the past week alone, including Peoria County reporting one new death today, a female in their 70s that was unvaccinated. That brings our to-date total to 803 deaths in the Tri-County. We're just under 1,000 cases in the Tri-County at home and isolating at 982, and there is currently 52 individuals hospitalized with COVID amongst Tri-County residents. In the past 17 days or so, it is the first time that we are finally under 100 new cases a day in the Tri-County as our 7-day average. Our ICU usage right now for OSF St. Francis and UniPoint Central Illinois is at 23 beds, and non-ICU is at 71. The hospital has reported one death in the past 24 hours. Likewise, our vaccinations continue to uptake. We now sit at 49.4% for Peoria County, 41.1% for Tazewell County, and 46.8% for Woodford County. For our speaker today and our focus today, oftentimes we talked about hospitalization, and it seems to be an abstract idea, especially for those individuals that luckily have not experienced that with COVID. But what we are seeing now is that this is an illness of the unvaccinated. And we need to make sure we let our viewers and our public understand the impacts of unvaccinated and what that hospitalization looks like. So with that, today we have Dr. Ravi Kashyap from UniPoint, pulmonologist, to kind of further discuss the care and treatment regarding COVID-19.
Thank you, Monica. My name is Ravi Kashyap, one of the pulmonologists and intensivists with UniPoint. So as Monica mentioned that when the patients come to ICU, I can explain that how scary it's for them. I see them every day and I wanted to let people know and the family know how they feel. So once they come to us, they are requiring high amounts of oxygen, about to be in the breathing machine, and I can see the fear in their eyes. Many of them have mentioned that they should have taken the vaccine, but some of them are unable to tell me that. Anyways, when they come to intensive care unit, we take care of them, try to avoid intubation if we can, but in majority of the cases they get intubated. Intubation meaning by put on the mechanical ventilation, we are breathing for them. And from then on, because of lack of oxygen, many times, majority of the times, we put them on the stomach, we call prone positioning, because that improves oxygenation. So 16 hours out of 24 hours, they're in the prone position, and then we put them back in a supine position and repeat that again and again till and if the oxygenation improves. In the process of treating them, because of lack of oxygen, because of many other things, we have seen other organs failing, many times kidneys, liver, many times heart disease. So the other organs start failing. And if you're successful to get them off the breathing machine, we are very happy. But unfortunately, I can speak for intensive care unit. Once you're on the breathing machine, your chance of survival is less than 50% at the best. And this is not just us, but nationwide. So that's how the patients go through. Emotionally speaking, as you might know, all of you know, the family are unable to see the patients. So the only support for the patient when they're very, very sick is the doctors and nurses. So what that is doing is not only taking the physical toll on the healthcare providers, but also emotional toll, to the extent that many of the nurses, ICU nurses, who have been working in ICU for years and years, finally stopped working. They say, we cannot keep taking it. So what is happening is that the healthcare resources are getting scarce. I'm not talking about the ventilator or the rooms, but the healthcare providers, the respiratory therapists, the nursing, and I'm so afraid maybe if it continues, the physicians as well. What can we do to protect our resources and our health is take the vaccination. It does help. Overwhelmingly, I'm seeing in the intensive care unit, the patients who are admitted are non-vaccinated. There are very few handful patients who may be vaccinated. Beyond that, because this COVID has been over a year and a half old now, as a pulmonologist, I see these patients coming back to me as for the shortness of breath, inability to walk, requiring lots of oxygen. So what we call long hauler syndrome. One of them is pulmonary fibrosis. It can leave the scar tissue in the lungs, and people are unable to breathe. And it just goes on and on. I did not know last year how long that will last. Now I do. It's permanent for them. More commonly, they are also complaining of fatigue. They are very fatigued. They cannot do what they want to do. They are also noticing that they have some memory losses they cannot explain. They say, I feel fine, but all of a sudden I lose my memory for a second or two. So that's other things we are seeing. So bottom line is, this is the family need to know what other loved ones are going through when they're in intensive care unit. It's not like you get hospitalized and go home. It's not a big deal. No, the truth of it is, if you come to intensive care unit, your chance of survival is less than 50%. So please, take the vaccine for yourself, for your loved ones, for your children, because you can protect them by making a cocoon around them by taking vaccine. Maintain a social distancing, wear the mask. What we knew, we thought the mask may prevent the infection spread, is confirmed. The study came out yesterday from Bangladesh, clearly shows that the masking has decreased the spread of the infection. So please do that. Please wash your hands and help yourself and help us. Thank you.
Doctor, you mentioned obviously the importance of getting the vaccine. You see patients come to the ICU, come to the hospital, don't have the vaccine. Do families seeing their loved ones in these conditions, do you see cases of folks being convinced by this to get the shot?
We are seeing the mixed bag of it. So many patients, the family, when they see the loved ones going through it, they have been convinced to take the vaccine. But unfortunately, I'll be honest, some families, some patients are saying, or the family is saying that, this is not real, or they have many other excuses. We try lovingly to them to try to explain, answer their questions. So no, not all of them are convinced, but many of them are.
So you're saying there's one person in a bed who's in ICU care, and their family next to them is saying, this isn't real?
Yes.
How do you handle that? That seems...
So there's a lot of misinformation in the community. So what happens when I ask them, what do you think it is, and they say just a pneumonia, and and I don't want to argue with them at that time. It is a pneumonia. It's due to COVID-19. So I try to explain that to them, but then we leave it to that. I mean, I try to convince them, and I tell them that please get tested, number one. Number two, get the vaccination for yourself. And some of them are very clearly, I can say for the last week, one example, this week actually, the wife clearly said, I do not believe in the science, and I would not take the vaccine.
Lastly, with that fact and with those things happening, you personally experiencing it, what would you say to folks who are out there who want to help get their community vaccinated? What should they do? You're obviously facing these issues yourself, but what do you think is the best approach to convincing folks about the importance of vaccine?
What I tell my patients, please talk to your doctors. I mean, when the patients come to me or the family come to me, I said, now you are in front of a doctor. Please ask the question. What question I can answer for you? What are your concerns? I think pushing back anybody to take the vaccine will not work. Is giving the right information. And the best thing will be to say, if you have a question, please let me know what the questions are, what your concerns are, and tell them the facts that this may or may not be true, what you're thinking. That's the best approach at this time, because and again, I'm speaking from my personal experience with my patients. They clearly said, do not believe in government. I said, well, believe in your doctors. Don't believe in the government, believe in your doctors. And I'm a doctor, I'm telling you what to do. And I have been able to convince many people, but not all of them.
Doctor, you were talking about the long-term COVID and the scar tissue in the lungs. You're finding that this is going to be a permanent thing for some of these people?
Yes. As of now, say for example, they were infected, say, June last year, and I see them with scar tissues now, that will be permanent.
The scar tissue will be permanent?
Yes. All right. Thank you. Thank you.
Opening up to questions.
So, given that you said that this is a pandemic of the unvaccinated now, I guess one thing I've been wondering is, will local health departments at any point start releasing a breakdown on the number of new cases, who's vaccinated, who's not, deaths, who's vaccinated, who's not?
The question being, will we start kind of breaking down our data much more granularly about vaccinated versus unvaccinated? This is something that we were talking about actually on the state call, even about sharing that data and being much more transparent. The difficulty is that with the upcoming booster vaccinations for especially individuals that are immunocompromised or possibly over that 8-month period, that's going to change your vaccination status. There's a medical terminology for if you are fully vaccinated. And so I think part of that is waiting to understand what that definition change is going to look like, how we are going to capture that data meaningfully before we start breaking it down further.
But you would say that breaking it down further might be helpful in illustrating just how much impact the vaccine can make.
I definitely think breaking down those that are vaccinated versus unvaccinated to just fully understand that picture. I think both hospital systems, I know in their social media, do a fantastic post where they legitimately show you how many that are hospitalized are there and how many are vaccinated versus unvaccinated. I think our data even is also can be shared in a meaningful way. Likewise, I think what's challenging for us is that we look at that data and, to the pulmonologist who sees it day in and day out, that severe case. What can be frustrating to us is that, again, majority of our cases are people that are eligible for vaccination. Right now, everyone that is hospitalized for Peoria County residents are eligible for the vaccine. And so, again, it's that confusing. How do you balance the fact that there is something that clearly has been proven to work time in and time again, and yet we are still having these conversations with individuals about the science behind it, the impact of it? It's really hard to kind of make that connection.
We asked last week about, the issue of kids that are under the age of qualify, under 12, and people are still curious when this will come. Is it still fair to say next year, or what would you say you think is it?
So the question being about vaccinations for children, I think the next age group that most likely will be released will be the 5 to 12 age range. And I know Pfizer's CEO has come out and said end of October, early November is the timeline they're going for. I think after that, then you're looking for a younger age range. And a lot of this has to make sure that we're talking about, again, a very vulnerable population that we want to protect and make sure that, these kids and parents that have volunteered their children to be a part of these studies. I mean, let's talk about living angels right there to do that. But also to make sure that the data is robust enough for us to have that follow up and understand kind of what those impacts are. Again, I think all of us are waiting for that, and we should see a lot of shifts in policy once we can get more and more individuals, especially in age range that can transmit heavily, to get vaccinated.
But the day the FDA and CDC say, yep, go ahead, could the Tri-County say, yep, we'll do it right now, we're going to vaccinate this age group?
So I think there is a lot of steps that need to happen. So first and foremost, FDA approval. So FDA comes out, and we saw this with the vaccine last year too. When the FDA approves it, there is a group known as ACIP, the Advisory Council, that will actually go in and give kind of the recommendations about how you dose, when you dose, what other things you need to consider when you are administering the vaccine. And usually, once that is released, standing orders get updated immediately, and we can start the process.
Speaking of children, can you talk a little bit about the Test to Stay initiative that certain school districts like District 150 is participating in as sort of a alternative for quarantine for 14 days when they come into contact and so on with the virus?
So the Test to Stay is an option that is only available to schools that have a universal masking policy in Peoria County. And so those are schools that, regardless of your vaccination status, you're universally masked. What that allows the schools to do is, because we recognize the importance of in-person learning, we recognize that some of our mitigation levels have to change. So last year we were very big about 6 feet. Now to allow for in-person learning, we say 3 to 6 feet, or 3 and less, depending on other mitigation levels, such as universal masking. So when a school opts to do universal masking, what we're able to say is that if a child's exposure to COVID only happened in a school setting, in a classroom setting, then they can actually stay in person as long as they are tested frequently. And it's a testing cadence of 1, 3, 5, and 7 days. As long as those tests come back negative, that kid can stay in school. But the key is the exposure has to happen in a classroom setting. So, two girls are best friends, they see each other outside this classroom, and that's where the exposure happened, they would not be eligible for it. But if they're in the same classroom and that's the only point that they were most likely interacting with each other, then they would be eligible for that type of that testing schedule.
And do you know any other schools besides Peoria Public Schools that are doing this?
So Peoria Public is the first school to do the Test to Stay, and that's partly because they actually got testing capacity last year. So they had it in place, they were using it. A lot of our other school districts are coming online with testing right now, and so when they have those available, they'll be eligible to use it as long as they are universally masking.
And I know the testing in schools has been a big issue for a lot of districts. What's the health department's role in helping to facilitate, getting that up and running to the capacity it needs to be?
So here in Peoria County, the way we've worked with our schools for testing capacity is a couple of ways. Working with Superintendent Beth Kreider, we actually brought in what's known as the SHIELD testing in the springtime to see if any schools were interested in signing up for SHIELD, which is a saliva-based testing. In addition, we have what's known as Binax now. It's an antigen test. It's point-of-care testing. And we allow for schools to go through a CLIA waiver. CLIA is a fancy way of saying that they don't have to be a certified lab. And then they actually are able to administer the test under our medical director, Dr. Stoner's standing orders. So we partnered with our schools. We worked through providing them ways to get their CLIA waiver, assisting them in their application, giving them an MOU so that we understand the responsibilities, as well as a standing order copy that they would be operating under. And so once they've kind of walked through those steps, gotten the way to input the data into the state system, we turn around and we provide them with Binax testing. And our schools are taking full advantage of that, and we are very excited that they are taking advantage of it. It's a great tool to have on site.
School administrators are worried, or told us in worries, that there's a possibility of the return of remote learning for all schools statewide. Is there any truth to that?
I have not heard any of that type of policy decision making. I think it's always something that we're concerned about, any type of mitigation we're concerned about, and I will say the best way to avoid mitigations is to get vaccinated.
Just to understand a little bit where the Tri-County area sits right now, it sounds like from the numbers that the COVID cases have sort of trickled down from last week. Have we gotten the numbers from Labor Day weekend, and once they get in, do you foresee those cases going back up? So
I don't know if we necessarily are seeing a downturn. I think things are settling down. We're starting to see some plateaus. We're actually seeing it in southern Illinois. And we're even seeing this nationally, and they call it sadly, that the Delta variant is burning out. It means it's not finding as many hosts because it's making enough people sick. So that's a lot of the surges we're seeing. Having said that, though, there's a lot of things that can change. Holiday weekends, people are getting laxed on mitigation. That can really spike at these numbers at any given time. If you guys remember last year when we were doing this, one nursing home outbreak created 50, 60 cases for us overnight. So it can change rather quickly in this type of environment. Having said that, we know our hospitalizations are up, and that's always a lagging indicator. So we expect our hospitalization numbers to stay up, and as our providers have told us time and again, they're going to stay up because this is not something that someone checks into the ICU and checks out the next day. This is a long-term visit in the hospital. So really, we're kind of at that precipice where as long as we continue to do the mitigations that we're seeing in our schools and other settings, we should start seeing a downturn. But again, didn't expect us to still be talking about this at this point in time either.
Right now, it's a plateau.
Right now, we are plateauing, and that's good. We want to plateau. We don't want to keep seeing this huge surge that we've had. And again, for the past 17 days, we've been averaging 100 cases a day, which I think is a lot for a tri-county region to have.
Where are you seeing the most transmissions? What settings?
The most settings that we're seeing the most transmissions, that's a hard conversation to have. I would say where we're seeing the most of the cases is in our younger population. So some people would kind of equate that to mean then transmission is happening in a school setting, but it's not. It's actually happening in everything outside of the classroom setting, which is, again, the request we always have had is that the burden falls so squarely on our superintendents, and it's unfair for them. Parents, other club sports, other activities need to shoulder the fact that for our schools to succeed in having in-person learning, kids need to be following those mitigations, getting vaccinated across the board. They're doing everything they can in the building, but then when they leave the building and they go to a dance team or what have you, and all mitigations go away, you're then just bringing it into a school where now they're quarantining and having to exclude so many students. So we're seeing the largest numbers in our under 19 population, but it does not necessarily equate to that we're seeing transmission in school settings.
So the under 19 population, what percentage is in the under 19 population?
Just over 30%.
30%.
Of our active cases. Yep.
And then the mandatory testing for teachers, how big a burden has that been on you guys? Because the schools suddenly had to come up with testing, frequent testing for these teachers, and unlike Peoria Public Schools, most of the districts did not have it. How hard is it going to be, and has it actually started in some of these school districts?
Well, it has not started yet in the school districts, partly because the governor did extend out the deadlines for that. I think the burden is a mix. I would say the group that shoulders the most burden is our superintendents for our school districts. They're trying to juggle a lot, and this was another added thing for them to juggle unfairly. For us, it's been processing paperwork, getting a lot of follow-up, and getting testing out to them as fast as possible. But it is a large concern, and I think the other concern too is that Binex now is antigen testing. It's a point-of-care antigen test, and it's limited, and so it needs to also be prioritized in school. So really, we want these tests to first go to symptomatic students so that we can see if they have COVID or not necessarily used for employment screening purposes. And so if the supply runs out or gets any lesson and we have to prioritize more and more, it's going to be really difficult for our schools to find additional tests just for employment reasons. And so again, the group that doesn't have to do testing are vaccinated individuals.
When do you guys expect that to begin then?
I think right on track of when the governor's order starts, we'll see some of that. A lot of our schools, though, when we were in February, when we started the vaccine campaign, we had a lot of teachers sign up for vaccination. So we do feel that there is a larger percentage of our teaching staff that are vaccinated. Now, the key is it's school personnel, and that's not just a teacher. That's anyone within the school setting. And so you can imagine that that's not going to groups that may not have necessarily been first and foremost in those lines to get vaccinated. So we know there's going to be some discrepancy between actually teaching staff versus other school personnel.
Has the governor's orders pushed, do you think, some people to get it?
I think so. I do think the governor's orders have pushed some individuals to get it. I think part of it has been, just again, that gradient of where people were sitting on getting a vaccination. Was it today? Was it tomorrow? Maybe it helps move the process along. But I think at this time, when we talk about vaccinations, we're looking at any type of tool in our arsenal to get more and more people vaccinated.
And with other industries mandating it, have you guys seen more people requesting the vaccine?
We definitely have seen more people requesting the vaccine, and I think our numbers have shown it. The fact that we're getting closer to 50% fully vaccinated in Peoria County, for a very long time we were sitting at 43%, and then when when OSF, St. Francis Medical Center, and Unity Point made their announcement, I think we saw another jump to 46%, and then I think we saw another jump to 48%. So I think we are seeing those incremental changes once policy decisions have been released.
Do you think that this is the only way that we're going to get the majority of the population
Do I think it's the only way? For the last stragglers, perhaps, but I think to what our physician here also shared, and what our groups, previously has also shared, is the fact that there's also a group that's just not going to get it. But I think any type of way we can communicate and help people understand, because even as an employer, if you think about it, you have a staff individual that now has a long-lasting health issue from COVID because of permanent damage to their lung. As an employer, you're looking at for your well-being of your staff, and vaccinations are going to be a key way to protect your staff as well. So, I think these type of policies are going to be what we're going to see more and more to push us over kind of that final line.
Speaking of the unvaccinated, I think nursing homes have been kind of like lagging behind. I think we had statistics that show some of them were less than 50% of their staff. How are they doing with the Delta variant?
We've, luckily have not seen a lot of outbreaks in our nursing home settings. We've seen one-off cases here. But I think this is where the challenge happens is, again, if you don't have a workforce that's vaccinated, that's caring for medically fragile individuals, it does create a perfect storm, especially as we know that there's the need for boosters or a third dose coming up soon. So I think the next few months are going to show us a lot more.
Well, one last question for you. The Civic Center, is it here to stay for a while, you think, that site?
The Civic Center is here to stay for a while, the testing site on Fulton. We're very excited for it, and the turnaround time is great at the site. It's about 24 hours for results. And again, that testing site is open Mondays, Wednesdays, Fridays, and Saturdays. So please take advantage. And there's also all 3 vaccinations available there too. So it's kind of full service, and that's great to have in a location. And again, the Civic Center and Rick Edgar and his team have been just great partners for that.
So you can choose your vaccine?
You can choose your vaccine.
You can choose your
There you go. We're in a world now that you can choose your vaccine, so there's nothing stopping you. Thank you, guys.
Hey, well, one more question, Monica. With the flu season coming on, can you get your flu shot at the same time you get your COVID shot? Is there a reason why you shouldn't do that?
The question is whether you should get your flu shot and your COVID shot together. Previously, when the vaccine was first released, the COVID-19 vaccine, they were asking for some gap time, about 14 days. Really, no, you don't have to wait. You can get both at the same time if you so choose. If you decide to delay a week or 2 weeks, that's fine. The big thing now, too, especially as we're entering this season, is get your COVID vaccine if you haven't already, and also get your flu vaccine as well.